Okay, good evening, everyone, and welcome to Module 12. And in this lecture, we're going to be discussing objective. Last week we discussed subjective. This week, we're going to discuss the objective part of the SOAP notes. And if you all remember that the SOAP note is an acronym. And what's the acronym about? Who can spell out the acronym for me? At least everyone should name at least one of the four words that are in the acronym. Okay, so we have Charlene has very aptly put it: subjective, objective, assessment, and the plan. And who can remind me what the subjective is about? Quickly, everyone should be able to mention at least something quickly. Subjective basically is about patient symptoms. Is it patient symptoms only, or what qualifies the patient symptom? What are some other words we can use to qualify the patient symptoms? Observations, yes. Verbally expressed by the patient, absolutely. So basically, it's the story that the patient tells you. I've been having back aches for the past 6 months. It's worse when I bend down. How do you relieve the back pain? Well, I relieve the back pain when I sit in hot water or when I stretch. So that's basically what you call a subjective part of the patient visit to, or patient part of the clinical assessment of a patient. So the next part of the patient assessment is the objective part that we're going to talk about today. But also in weeks 13 and 14, we're going to discuss the assessment, which is basically the time when you do what with the patient. Exactly. When you make an impression, you could either make an impression or a diagnosis, or a differential diagnosis. An impression is a thought of what you believe might be wrong with the patient. A differential diagnosis is when you're not too sure exactly what's wrong with the patient, but you've decided on three types of diagnosis, or four types of diagnosis, or even as little as two types of diagnosis. So you've arrived at some sort of thought process in terms of what might be wrong with the patient. The patient might have a fever. It might be the flu, or this patient might have just arrived from Latin America or from Africa or from Asia, where they have malaria. So when you're making your initial impression or your initial differential diagnosis, you can probably say the patient has the flu or the patient has malaria. Now, in order to determine exactly what the patient has, you have to establish a plan. And the plan of action can include establishing a definitive diagnosis, which means you narrow down your diagnosis into one specific component. So that means you've done maybe a blood film. And for those of you who are not really medical, a blood film might possibly be a situation where you look at the blood under a microscope and see that you see some malaria parasites. and that will immediately tell you that more likely than not, this patient has malaria. Or maybe you look at a blood film under a microscope and the patient does not have parasites in the blood. And in that case, you could say that you're ruling out malaria as the cause of this person's problems. In that case, you can now make a definitive diagnosis of the flu. Okay? So, and then, of course, that's of course your plan. Your plan is exactly what you do in this situation. So, in the case of the flu, you might tell them to take some Tylenol or some other pain types of medication. You might tell them to have to get plenty of rest in bed. You might tell them to drink plenty of water. You might prescribe Theraflu for them or Tamiflu for them. In the case of malaria, you might want to prescribe some anti-malarial medications for the patient. So that's exactly what your plan is. But today we're going to talk about the objective component of the SOAP note. And the objective basically consists of, first of all, vital signs. And vital signs, who can give you some examples of what vital signs are? Okay, your blood pressure. And the normal blood pressure is in the neighborhood of about 120 over 80. So, for the most part, you're looking at a range, a normal range, because you divide the blood pressure into diastolic blood pressure and systolic blood pressure. Does everyone understand what blood pressure is? Just say yes or no. Great. So everybody understands, for the most part, what blood pressure is. Let me just drink some water. Okay. So I'll quickly just breeze through it. Blood pressure is a situation where the heart pumps blood through the vein, through the arteries. And when the pump blood out, you have a higher pressure. And that pressure is called the systolic blood pressure. And that's what you normally have on top. So for example, Chisholm put in there 120 over 80. 120 is the systolic blood pressure. And when the heart relaxes, the blood pressure goes down. And it goes down to its lowest limit, which is the 80. So anything over 140 for the systolic is considered high, and under 60 for the diastolic is considered low, unless you're well trained in terms of being an athlete or well conditioned. And for the diastolic blood pressure, you're looking at the lower level of about 50 and a higher level of about 90 of being within normal range. Okay? Then you have your pulse. And whenever your heart pumps out blood, it pumps it out, in beats, in heartbeats. And when it flows through the arteries and the veins, it flows through as pulses. And when you touch your wrist, you can actually feel the pulse of the blood flowing through your arteries. So any other vital sounds? I see blood pressure, I see pulse, I don't see anything else. Well, you have to remember there's respiratory rate and there's temperature. And what is the average respiratory rate? And what's the average temperature? Let me just put those two things out there. Okay, 98.6. Well, good. 97.8 will still be within the normal range. And what of the respiratory rate? Well, in order to save time, I would just pretty much say anything between 19 and 22 breaths per minute. Okay? So that's your vital signs. And then you have your physical exam. And your physical exam is pretty much along the lines of what the doctor would do in order to poke at you and test you, touch you, feel you, test those areas of your body, listen to you in terms of using the stethoscope to see what's going on with you. So let's say, for instance, he thought you have some belly pain, and he's touching your belly, and he's touching the right quadrant and the left quadrant, and the right upper quadrant and the right lower quadrant, and so on. Wherever you have pain, that pain might be significant based on where he's touching and how the doctor or she can elicit pain or discomfort wherever they are, including looking at your eyes, including looking at your eyes, including possibly listening to your heart with a stethoscope, and so on and so forth. Looking at your feet to see if there are any swellings, So looking at your eyes to see if they're pale, your palms of the feet, the palms of your hand or the soles of your feet. Skin color, absolutely. And all these can tell or can lead or can help to a physician or a provider determine what's wrong with you. And then the next thing people want to do, or a provider wants to do, is to possibly do some tests, some lab tests. And these lab tests further help to cement an impression or a differential diagnosis or a definitive diagnosis of what's going on with you. So let's say they do a lab test, for instance, and the lab test comes back showing that you have an hemoglobin of 7. Who can tell me what hemoglobin is? Hemoglobin, which is also called HB among the lay folk. Wow, Charlene is really putting some fire on it tonight. Absolutely, you can pinch the top of your finger and see how red it turns, or you can just look at your palm and you can just pretty much tell if someone is pale. And if they're pale, it might be an indication that that person has anemia, which is basically a low blood count or a low hemoglobin. Okay? And then finally, it might include things that include things like your age and your weight and your height, your body build, and so on and so forth. So that basically, in a nutshell, is a basic description of what you expect to be doing when you're completing the objective aspects of an EMR soap mill. So I'm going to go ahead right now and log in to Practice Fusion. And since you guys can listen to me, what you can do is that you can also log into Practice Fusion, but you can minimize the screen so that you can continue to post your questions, and of course, you can listen to me at the same time as well. So that way you can at least see what I'm talking about. But you're welcome to view this post when I post it. And you're welcome to actually copy the sequence of events as I do them in the electronic medical record. So right now I'm logging into Practice Fusion. So I've put in the practice ID, which all of you have. Then I'm putting in my password. And I should be able to log in. Now it's telling me I cannot log in. Let me see. Let me try again. Okay, it looks like it's agreeing with me this time. Okay, why can't you log into Practice Fusion, Kinley? Were you invited? Did you get your link? Okay, let me ask this general question. Who did not get an invitation to log into Practice Fusion? Okay, basically I invited everyone into the class. Oh, you know what? We changed the format. So, you have, who can remind us, the practice ID is FICON Institute. Okay, well, we want you not to use that invitation anymore because we changed the format. So basically you'll be logging in with, I think the user ID is FICON Institute. So that's the user, the practice ID. Then the user ID is P Institute. That's it right there. And then what's the password? Does anyone remember the password? I know it's in the slides that that I sent to Dr. Kalka to go over with you. Okay, so that is the password right there. FICON Alpha $Alpha. Alright? So that's what you do to log in. And when you log in, the next thing you have to do is to create your patients. Alright? And I've posted Dr. Kalka's recorded lecture online. So, who does not know how to create their own patient? So everyone knows how to create their own patient. Good. We just had issues with logging in. Okay, that's good. So, without further ado, we can go ahead. Alright, so today we're going to continue on in the silk notes by doing the objective parts of the notes. So, you do not need to create a new patient. Okay, Charlene says, I just have issues with not being able to change things when you want to. Excuse me. Well, as long as there are some things you can change and there are some things you might not be able to change. So what exactly are you trying to change? Okay, what did you put in that you want to change? Okay, your allergies. Okay, well, what basically happens is that if you signed, did you sign your chart? Did you save or sign your chart? Because once you sign your chart, you can't really change anything. So you shouldn't sign your chart until you finish with weeks 11, 12, 13, and 14. Okay, I messed up and I put the wrong thing and you saved it. Alright. Okay. Give me 1 second. So basically, you do not want, all you want to do is to save your chart. You don't want to sign it. Because once you've signed your chart, it means, because even though we're doing weeks 11, 12, 13, and 14 over 4 weeks, you have to remember that everything we're doing over 4 weeks is actually done from the time the patient goes into a clinic until the time they leave an hour later. And an hour later, when they leave the clinic, the physician signs the chart and then goes into another chart. So even though we're going over a span of 4 weeks, do not sign your chart. All you need to do is to save your chart or to save whatever you put into it. But I will look into your chart and I'll let you know what you did wrong, okay? So basically you go back to your chart, to your patient, and each of you has a patient or should have a patient that is basically your name. So for example, Eunice Upton's patient's name will be Eunice Upton. So I'm going to go in here and look for one of my cases, and let me just do a quick search. And you don't need to scroll through all the patients in here. You can go into where it says first name, or you can do last name, and you can search for your patient. Alright? And I have several choices from as FICON, and I'm going to choose FICON for my example today. Alright. So this is basically a 48-year-old male, and they came, well, theoretically they came an hour ago, but for practice purposes within this class, they came last week, and they presented with, what was it they presented with? Abdominal pain, vomiting, fever. What else did they have? You can each throw out some symptoms there. No audio. Oh. Hello? 1, 2, 3, 4. Is it only Eunice that doesn't have audio? Okay, looks like I might be having audio issues. Oh, so you can hear me. It's only that it's breaking up. Okay, testing 1, 2. Can you hear me? Okay, Chisholm, you can say something. Okay, and I can work with you off. Let me see if I can fix this audio problem. When you hear me, please, please let me know. Okay, can you guys hear me now? Okay, great, wonderful. All right. So moving along, we've logged into Practice Fusion, and for those of you who still have problems logging in, you know, I can work with you offline later. But basically, the username, the practice ID, and the password is what we gave out before. So when you just make sure, but you know you need to you have them in proper order. Don't mix up the practice ID with the user ID. Okay? All right. So what we're basically going to do now is that on your patient that's in your name, you're going to go to the chart that you were working on before. And the way you would know it is that if you look on the left column over here, you will see a date that corresponds to the date you started out entering the patient information into the chart. So you click on that date. You should not have more than one date. If you have more than one date, it means that you've seen the patient twice. And you only want to see the patient once. It's one encounter. It's one visit to the clinic. And you're charting the patient through that encounter to the clinic. So in my case, I'm going to start a chart since I didn't do what you guys did last week. But in your case, you're going to go back to the chart that you were working on from last week. Okay, so I've logged into my chart, and the first thing I want to do is I want to put in my vital signs. So who can suggest some vital signs for me? I'm doing height right now. So how many inches tall is this guy? The patient that we were dealing with, 5'9". Okay, so 5'9" is 5 times 12, which is 72. Actually, 5 times 12 is 60, plus 9, that's 69 inches. All right? What weight is this patient? Anyone? What weight is this patient? Okay, 190 pounds. Femi said 218. Okay, let's go ahead and do 218 so we can include some other people. And that shows us immediately that this patient has a BMI of 32. Okay, so what's the blood pressure? Why the 12? Because there are 12 inches in 1 foot. So if someone is 5 feet 9 inches, you multiply the 5 by 12 to get 60, and then you add the number, so that's now 60 inches plus 9, which is 69. Okay? I hope my math is right, guys. Okay, good. So, blood pressure. Who can suggest blood pressure? And whenever you're suggesting blood pressure, always put the systolic first. And the systolic is always the higher number. So, I'm still waiting for a blood pressure. Whoa, 200 over 110. My goodness, that person should be in intensive care. All right? You know what? For the benefit... Okay, can you guys hear me? All right. Yeah, and I think for the benefit of the fact that we are dealing with someone who has a bleeding ulcer, and I will explain to you why later, I'm going to change the blood pressure to 90 over 45. Okay? What temperature are we suggesting for this patient? 97.8. Let's assume this patient has a slight fever. So we might want to give him like a 99. Okay? What's the pulse rate for this patient? What's the pulse rate for this patient? 70 is way too high for a pulse rate. $45. My goodness, you want to kill this patient, don't you? Maybe that's a little too high. Maybe 24 is a little too low. 35. Okay, let's just go ahead and put 30, and I'll explain why. Oh, sorry, the pulse rates. I'm mixing that up with respiratory rate. So Chisholm said 70. That's a little too low, and I'll explain later. But let me go ahead and put 90. And then what of respiratory rate? Well, you know, I'll just put 30. Let me go ahead and explain myself. The blood pressure is low because this patient has lost a lot of blood. remember, has been vomiting blood because of the ulcer, and is probably bleeding blood into the abdomen and to the stomach as well. Well, yeah, maybe into the abdomen if he has a perforated ulcer, and into the abdomen, and probably bleeding blood into the bowel as well. So because of the lack of, the low blood, the loss of blood, we can assume that the blood pressure is going to fall. So that's why we're putting him as having 90 or 45. The temperature is, we're going to assume this patient has a fever, and the reason is because the likelihood of the patient having an associated abdominal infection is very high. All right? And maybe just because of what the patient is going through, that might also add to the reasons why the patient has a fever. And then lastly, a respiratory rate of 30, which is way above normal. And this is because of the simple fact that the patient has lost a lot of blood, and the heart is working overtime to pump blood around the body to supply the body with oxygen. So last week we did the subjective. So this week we're going to do the objective. So I'm going to put my cursor over into the objective area, and the first thing I'm going to do is the review of system. Well, the review of system is basically a subjective criteria. So let me just go ahead and do the physical exam. All right? So first of all, I clicked on the O for the SOAP note. The next thing I did was, under all the templates that came up, I clicked on the template for general physical exam. So the first thing I've done are the vital signs. Now I'm doing the general physical exam. So the first list on that template is patient in distress, and I'm going to indicate yes, the patient was in distress. I'm going to click on that, and that automatically helps me populate the SOAP note. So I'm going to put the return button here, and let me go ahead and see what else. Okay, some of these, for example, the nose, the throat, the neck might not necessarily be germane to examining this patient, but the chest is important. So we listened to the chest, and we found the chest to be clear, which means there's no respiratory infection. We found no rales, no rhonchi, and no wheezing. All right? So the next thing, I'm going to put the back cursor, and the next thing we're going to look for is the heart. So we're going to say pansystolic murmurs, and we're going to say murmurs. And murmurs are basically an irregular heart rate, or not necessarily an irregular heart rate, but abnormal heart sounds. So let's say, for instance, you have a problem with one of your valves, then that will produce an abnormal heart sound. And in medical practice, we call that a murmur. So I'll say murmur is probably due to mitral valve regurgitation. You don't really need to know all these terms. You just need to know that you know enough to populate the chart. And what you can basically do is that you can take each of these options and research them online and see if they have anything to do with you know, a ruptured peptic ulcer, which we're suspecting this patient is having. Alright, and once you copy you don't necessarily need to reinvent the wheel. Once you copy what I'm documenting in the EMR, just the way I'm doing it, even if you just copy, that's fine. Excuse me, as long as you can reproduce what I have in the chart, that's fine with me. If you want, you can put extra. That's very good. It means you understand what's going on. Okay. Okay, some people can't log in. So we're going to try and deal with that before we log off the class tonight. And I'm going to rush through the rest of the stuff I have to do so we can try and see if we can fix some of these problems. Okay? Alright, now there's one thing is that since we're all using the same username and password, you might not all be able to log in at the same time. Alright? So, abdomen is the next thing. So, in this case, let me actually go and... So we're basically going to say... So the abdomen, we have epigastric tenderness. And all that pretty much means is that when you touch the upper part of the abdomen, the upper part of the stomach, the part just below the lungs, in the middle of the abdomen, there is pain. And that pretty much is where the stomach is. So we're saying that this person has a stomach ulcer or a peptic ulcer and it's painful. Alright? And then when we say radiating to the flanks, all it means is that you don't just only feel the pain in the middle of the abdomen at the top, but the pain radiates to the sides of the abdomen as well. Okay? Do we understand so far? Good. Alright. So no masses, which means we don't really feel any mass in the abdomen. Okay? What we might want to add is that the abdomen is slightly distended, and this might be due to the fact that there's bleeding into the abdomen, or it might be due to the fact that one way or the other air also got into the abdomen as well. Alright? Now the genital urinary system, we're not going to mess with that because it's not germane to having a stomach ulcer. Let's see. Skin. Let's go ahead and add skin. Alright? And what do we expect with the skin? Well, the skin is normal, no rashes, no lesions noted. However, there is pallor, or rather, skin color. Excuse me. Skin color is pale. Which means that this patient is probably, you know, anemic. Alright? So let's go ahead and see if there's any other Okay, let me add one additional thing. there are signs of dehydration. Alright? So, now the next thing we're going to do, we're going to put some labs in there. So, when you're looking at the video of what I did, right now I'm going to click on the paragraph. That will give us a little bit of space in between what we've entered and what we're going to enter now. And then now I'm going to add labs. But labs are not all normal, so I'm going to remove all normal, and I'm going to say hemoglobin differential white blood cells show high numbers of lymphocytes. Okay? So what does that mean? It means, first of all, it's a long-standing infection, and secondly, there might be some allergic components to the infection. So there's an abdominal infection, it caused an ulcer, the patient is anemic with low blood levels, so we can also go ahead and put in there hemoglobin, and for short you say HB is 7.5. And when it's under 10 for women and maybe 11 for men, it's considered low. All right. So what else are we looking for? Okay. So I think to keep it simple, we're just going to leave it like that. All right. So we're going to go ahead and save. And hopefully I should be able to save this so it remains in the record. For some reason it is not saving. Okay. Okay, so I think I have been able to save it. Let me go ahead and check. Yes, and it's there. All right. So I go to subjective. I come back to objective, and it's all there. So it's all saved. All right. So I'm going to go ahead and click on this button here to cancel the general physical exam template, and I'm going to look for another template. I hope you guys can still hear me. Okay, great. Okay, so I've clicked out of the physical exam template, and I'm going to go down to see if there's any other template I can use. I'm going to check wellness exam to see if there's anything here. Okay, I see something that reminds me here, and I'm going to add to my abdomen, and I'm basically going to say reduce bowel sounds. And reduced bowel sounds basically means that digestion is not taking place the way it needs to take place. So the intestines are kind of like, to put in layman's terms, partially paralyzed, or not really working as well as they should. All right, so I'm going down this tempo a little bit more. Okay, so I'm going to X out of this template, and I'm going to go to abdominal pain template, and see if there's anything I can use here. Okay, so I'm going to add something from this template, and when you log on and watch this video, you would see what I'm talking about. Alright, so basically I added there's tenderness without rebound, which means that there's a specific type of pain to the touch. So when the physician touches the stomach, there's a characteristic pain that when the physician presses on the stomach and leaves it suddenly, there's no increase in pain. That's what you call rebound tenderness. And you can check it online too, to see if you can get a better explanation than what I'm giving you now. I'm going to post it tonight. As soon as I can have it uploaded, I'll post it for you, okay? So, imaging, yes, let's go ahead and do imaging. And with imaging, we'll say ultrasound shows signs of a perforated ulcer. Alright, and I'm going to go ahead and X out of this template, and I'm going to scroll down to look for anything else that might want to remind me of anything. And that's it. So I'm going to go ahead and save again. You might see me copying. The only reason why I'm copying is because I don't want to lose it, just in case something happens. And the chart is saved. The sign for being saved just came on. So now when you log into the patient's notes, in your case, you will see the subjective is completed. You will see the objective is completed. And next week we will handle the assessment. And the week following that will, yes, so we go ahead and save. Do not sign, just save. Okay? And do not create a new chart. Continue from the dates that you see over here. So whatever dates you have from last week, or whenever the last time you did your assignment, that's the date you click on. Because if you go and start a new chart, the chart assumes that that's a new visit to the clinic. Okay? Yes, go on to the same date. Absolutely. Absolutely. So at least from listening to me, you all understand what I've done. And when you see it, you will see exactly what I've done as well. And you'll appreciate a lot more, you know, what I'm talking about. Of course, you hear my voice again, and you'll be able to put a voice to the completing of the objective part of the chart. Do we have any questions? Okay, great. Let me go ahead and stop recording so I can go ahead and take care of some of the signing problem. Okay?